Hi everyone, this is a video about the optimal way to use a nasal spray. As per usual, nothing that I'm saying in my video should be construed as medical advice. If you need any medical advice, please talk to your healthcare provider to get that advice. So nasal sprays are something that I use extensively in practice. Many of those cases are one of the main reasons that I use the nasal sprays in practice is for folks who are suffering from mold illness. Oftentimes they'll have mold colonization in their sinuses, and nasal sprays are just a really, really direct way of treating those sinuses, getting rid of the mold. If there are biofilms in there, and there could be other microbes living in the sinuses like yeast or different bacteria or whatnot. And the other reason that I recommend nasal sprays for patients is if they are fighting off a cold, or they just have a run-of-the-mill sinusitis or some kind of sinus infection or whatnot, then nasal sprays can be really useful, because rather than taking a pill that gets into the bloodstream and some of that will ultimately make its way to the sinuses, it can be a lot more effective just to use a direct nasal spray to get it right to the source where the problem is. When it comes to using nasal sprays, it's not uncommon for folks to use nasal sprays incorrectly. And by using a nasal spray incorrectly, it can lead to a few different problems. One is that the medicine, whether it's pharmaceutical, natural, whatever it happens to be, isn't going to get where it needs to go. And then the other problem is that sometimes that will actually cause, using a nasal spray incorrectly can cause a fair bit of irritation to the nasal passages if it's not going to the right spot. So you're kind of spraying it in the wrong spot, and then it kind of sits and festers where it's not supposed to, as opposed to getting into the sinus cavity. So we're going to go on a little field trip today. Going to introduce you to my lovely assistant, Mr. Bones. If you've seen my other videos, you have probably noticed him in the background. And so Mr. Bones, as you can see here, doesn't have a nose. He lost it along the way. But you can see here that if we look at him straight on, his sinus cavities go straight back. So if you imagine him, having a nose with, of course, nostrils pointing downwards, then if he was to take a nasal spray bottle, let's just field trip back over here to grab the spray bottle that I forgot to bring over. Hopefully nobody has vertigo as they're watching this. So if we pretend that Mr. Bones has a nose, and then that nasal spray bottle is the tip of the spray bottle is being put straight up a nostril, you can see that maybe I'll show from a side angle here. So you can see, oh gosh, too close. There we go. You can see here that if it's to spray straight up, it's just going to go right into the top of his nasal passages there. It's not actually going to go deep back. Oh my gosh. Definitely did not pick the wrong profession in terms of never should have been a videographer. So as opposed to going straight back where we want it to go. So those sinuses essentially go straight back. You can see they're quite cavernous, and that's where we want the spray to go. So ultimately we want the spray bottle to be essentially angled almost at a 90 degrees to the sort of his superior to inferior plane. So, so the sort of the incorrect way to use the nasal spray would be angling it straight up, which of course intuitively you think, oh yeah, just put it up the nostril, gets where it needs to go, but we really want it to go straight back. So what does that look like in actual practice? And so the way that looks in actual practice is, and typically this is how I recommend using the nasal spray for my patients. Again, not providing medical advice. If your clinician has recommended something else, talk to them first. But at the end of the day, the way that I recommend it to my patients, bearing in mind that we want it to go straight back, but the little tubing that's inside the bottle, if we hold it straight back, the tubing's above the level of the fluid, it's not going to work properly. So usually the easiest thing to do is to basically change the angle of my face as opposed to changing the angle of the bottle. We want the bottle pointing straight up and down. So I essentially want to bend over, bend my neck over top of where the bottle is, and then have the tip pointing straight up, insert that into the nostril, and then spray straight up. So what that would look like in real time would be something like this, and then I would spray. The other sort of common mistake that would be used when administering a nasal spray is taking a big sniff, and we think, oh yeah, we want it to get deep into those sinus recesses, and that is true. We do want it to get deep into the sinus recesses, but by taking a big sniff, it's going to encourage the spray to actually go down into the lungs as opposed to lingering in the sinus cavity. And what I can say from my firsthand experience is that if I do the nasal spray the wrong way, going straight up, then sniffing is quite important to try to prevent it from just kind of leaking back out again. When it's done the correct way, though, Then the spray is much more, it kind of diffuses in the sinus cavity. We saw on Mr. Bones over there, in the background there again, he deserves special attention today. We saw there that the sinuses are quite cavernous. And so what's interesting is that when you're doing the spray the correct way, you don't need to do a big sniff to kind of feel like to get it where it needs to go. You just spray, and then just because a little bit of what goes in must come out, doing like just tiny little sniffs to keep things in place as best as possible, so you don't have stuff dripping out of your nose. So I'm not sure if the microphone will pick it up. They're just sort of like little, like tiny little puffs, little sniff, 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 as opposed to like a, in which case a lot of the medication is going to get down into the lower airways. So to my understanding, that is the best way to administer a nasal spray, and I hope that this information was useful. If anybody has any questions or comments about this, please feel free to post in the comment section below. And if you have found using a nasal spray in this way or a different way has been helpful for you, or you learned something different, I'd love to hear what folks have to say about that. So again, feel free to post in the comment section below, and I will leave it there for now.